Chapter 10 Exam Technique General Rules Overview. This chapter provides an overview of the general rules for any exam. Many of these are simple, and yet we know from many students that they can be neglected. You will read most of this chapter quickly, and we suspect that it will make a lot of sense. You might want to read it again a week or two before you sit your first set of exams, perhaps subsequent sets of exams too. In Chapter 11, we shall try and apply these general principles to the specific exams that you are likely to come across in your time at medical school. Introduction. This chapter brings bad news and good news. The bad news is that contrary to popular belief, cunning exam technique will not allow you to pass exams at medical school without doing any work. The good news, however, is that appropriate exam technique will help you demonstrate what you know to your advantage. Preparing for the exam. Knowing the format and rules of the exam. Students who struggle often tell us, I didn't know what to expect from the exam. It might seem obvious, but you should invest some time finding out about the exam, including its structure and format. How many questions? How much time? What sort of questions will there be? All this information is crucial to your preparation. There will be formal information such as exam briefings and written information. But don't forget the informal information, including impressions from students in the year above. There was much more anatomy than I was expecting, or I didn't realize that the questions would expect us to explain pathology in terms of what we knew of anatomy, and physiology will be invaluable to you. One word of warning though, remember that these are rather subjective judgments. At one institution, we know performance in the third year exams would oscillate. One year, many students would fail the clinical exam and few the written. These students would then pass on the message that the clinical exam was really hard and no one ever failed the written, and the following year students would come well prepared for the clinicals, but poorly prepared for the writtens. This caused a rather predictable 2-year cycle. You might, therefore, try and speak to students in several years above you and try and build a consensus on their advice. Think about useful questions that you could ask, such as, what exactly happened in the exam? What was different from you expected? If you were doing the exam again, what would you do differently in your preparation? If you know the format of the exam, you can practice some mock exams. Perhaps you will use past papers, questions from books or the internet, or even write your own. As we discussed in our chapter 9, perform under exam conditions and especially under exam timings. Use these practice papers as a chance to practice technique and also as a diagnostic tool. If you get a question wrong, do not just memorize the right answer, but rather go back and revise that area again. Imagine that you get a question on one of the treatments of diabetes wrong. This probably means that you need to look at all the treatments of diabetes again. Perhaps even that you need to ensure that you understand the whole of diabetes. Extenuating circumstances. Every institution has an extenuating circumstances policy. You may not wish to think about this, but imagine that something terrible happens to you around the time of an exam. Perhaps a family member falls ill or water starts pouring into your flat and you have to camp out on a friend's floor. In these cases, your institution might take these circumstances into account when looking at your results. Examples might include, if you don't turn up for an exam, this is usually counted as a fail, reducing the number of further attempts that you can have at this exam and placing a bit of a black mark on your record. If you have good reason, the exam board might agree to make the next sitting of the exam that you do count as a first sit. If something terrible has happened to you around the time of the exam and your result comes out at just a very little below the pass mark, the exam board might look at your extenuating circumstances and agree that they prevented you from demonstrating your true level on the day of the exam. True to form, when things go wrong, the last thing you will want to do is try and find out the regulations and paperwork for extenuating circumstances. Get these papers together well before the exam and keep them somewhere safe. Hopefully, you will not need them, but you or a friend might be grateful for your preparation one day. While talking about extenuating circumstances, we ought to also highlight a few points. First, exam boards really aren't impressed with frivolous claims. If your hamster died 2 months before the exam, they are really unlikely to want to hear about it. They only want to know if there is a valid reason that your performance on the day did not reflect your knowledge and skills. Similarly, if you have a long-standing problem that has affected your work, perhaps your recurrent admissions to hospital with asthma and chest infections has meant that you missed most of the teaching this year. And then you failed the exam, they might surmise that you didn't have the knowledge and skills required for you to pass the exam because of all the time you lost. And so you should indeed have failed. If you were in an ER night the night before the exam with an asthma attack and breezed your way through the exam after a sleepless night, they might instead surmise that it would be reasonable for your mark to be a little higher. The University Learning Support Unit thought that I might have dyslexia. They referred me to an educational psychologist who confirmed it and wrote a report for the exams office. I now have extra time in written exams and feel far less stressed. Jamin, second year medical student. Clearly, any claim you make will need to be honest, and you will need to be able to provide written evidence to back up your claim. Whatever happens, don't lie. If things are going wrong for you in the lead up to the exams, just as at any other time, don't forget that the school would rather know about it sooner than later and that people are in place to help and support you. Most extenuating circumstances policies only work if you make the school aware of your difficulties before the exam and never after the results are out. Learning from the past. The final thing to consider before the exam is your previous experience. How have previous exams gone? Where are your strengths and weaknesses? If you often get too nervous before an exam, you should plan months in advance what you can do about this. Similarly, if you find a certain format of exam particularly challenging, then you should actively plan how to address this before the exams. Some tips in the following sections might help, as will various courses that your school will run. Students who say it's funny, but I never do well in multiple choice exams don't get much sympathy. Dealing with nerves. Everyone gets nervous before an exam. This is normal, and indeed a bit of adrenaline probably helps you perform better. If you have been following the advice in this book, then you should have learned the content of the course and revised it as you have gone along. Using deep techniques that ensured understanding and effective recall, you will have revised well and you can relax in the knowledge that you are well prepared. Of course, some people get very nervous at exam time. And in addition to the advice that we gave in chapter 9, there are some simple tips to follow on the day. Be early for the exam. The last thing you want to feel on the day is the panic that you might not make it in time for the exam. Aim to arrive at least half an hour before the start of the exam. Speak only to people who will make you feel good about the exam. This advice from Stella Cottrell is important. Louise's advice below gives a good example of learning from experience. I failed my first year exams because I was too nervous. I turned up and stood outside the exam hall with all my friends, and listening to them talk about all the things that they had learned made me panic. And in the exam, all I could do was think that I hadn't prepared enough rather than the questions in front of me. Every exam I have taken since then, I have arrived early but waited quietly in a nearby seminar room or cafe, glancing through my notes and practicing yoga breathing, and gone through to the exam on time. I haven't failed an exam since. Louise, newly qualified doctor. Sometimes people panic in the exam. There are always one or two students who look at the first question and feel panic. Some run out of the exam hall. This is simple stage fright. It happens every time an actor steps onto stage, every time a lecturer steps into the lecture theater, and every time a student turns over the exam paper. If this happens badly to you, badly enough for you to get up and try and run out, don't worry. It has happened many times before and the invigilators should be well prepared. Make sure an invigilator goes with you and let them talk to you. Halfway through their friendly pep talk to you, you are likely to interrupt them and ask if you can go back into the exam. When you look again at the questions, you will realize that some don't look so bad. During the exam, read the instructions for the exam. How many questions should you answer in what time? You should have found out this information well in advance and practiced timings in the mock exams that you sat, but check that nothing has changed. Watch out for easy errors that you could make. Instructions such as answer 3 questions from section A, 4 questions from section B, and 1 question from section C are a recipe for disaster. Write in big letters in section of 3 questions, in section B 4 questions, and section C 1 question right at the start so that in the heat of the exam you don't get thrown. Read the question. This might seem like a patronizing point, but as examiners we have seen hundreds of examples of students not reading the question and so losing out on demonstrating what they know. Some examples are shown in Table 10.1. The key way of ensuring that you read the question is to carry a pen with you and draw a box around, underline or otherwise highlight each of the key words or phrases in the question. Examples are listed in Table 10.2. One word of warning, you may not be allowed to write on the question sheet, for example, in a clinical exam where other students will be looking at the same question sheet. Our advice remains the same though, but rather than actually write on the question, simply imagine that you are doing so. Which words or phrases would you highlight? Plan your answer. Depending on the sort of exam that you are sitting, you may have more or less time to plan your answer. If you are answering essay questions, then you might have a good deal of time to plan. Short answer questions might warrant a minute of planning, and in clinical examinations, you might have only a few moments for planning. For example, when introducing yourself and gaining consent in an objective structured clinical examination, you might add in the plan, I would like to run through how to use these inhalers and also cover how each one works. Is that okay with you? We will cover planning in more depth when talking about each exam format. But the key point is that you should avoid leaping into an answer without having some idea how you will go about that answer. Table 10.1 examples of students not reading the questions properly. Q1 The following are classical features of left heart failure. Student reads right heart failure and gets each answer wrong. Q2 Please teach this patient how to use these inhalers and explain how each one works. Student just teaches how to use the inhaler and misses out on half the marks. Q3 lists 4 causes of flubbing, each originating from pathology in a different organ. Student lists only 3 causes, or student lists 4 causes originating from lung disease only. Q4 Doctors make populations less healthy. Discuss. Student only gives one point of view. Student focuses on health policy. Student focuses on treatment of disease. Q5 This patient complains of intermittent yellowing of the skin. Please conduct an abdominal examination and present your findings to the examiner. You have 5 minutes. Student spends 4 minutes trying to take a history from the patient and only manages a very brief examination and doesn't have time to present. Table 10.2 Examples of highlighting key points in exam questions. Q1 The following are classical features of left heart failure. Q2 Please teach this patient how to use these inhalers and explain how each one works. Q3 lists 4 causes of flubbing, each originating from pathology in a different organ. Q4 Doctors make populations less healthy. Discuss. Q5 This patient complains of intermittent yellowing of the skin. Please conduct an abdominal examination and present your findings to the examiner. You have 5 minutes. Manage your time carefully. One of the commonest errors in exams is running out of time and so not answering every question. You must be rigorous with your timing. For multiple choice questions, missing out 10% of the questions because you run out of time will drop your final mark by up to 10%. Not answering one of four essay questions will drop your final mark by 25%. The maths is easy, but people still do it. Two problems lead to students not finishing in time. One is planning. We would recommend that you write key time points into different parts of the question paper. We have called these time posts, and that you practice your timing in mock exams. The second reason is a strong desire to write a perfect answer. Look at the example below. Most marks are gained in the first half or two-thirds of the time spent on each question. After that, additional marks become increasingly more costly to gain. Imagine that you have 10 minutes to write about the clinical presentation of myocardial infarction, which will give you 10 points. This is one of 10 short answer questions that you have to answer. You might plan to answer the question under the headings of classical presentation and non-classical presentation. Within 5 minutes, you write about classical presentations and gain 6 easy marks. Having written all the obvious things, gaining additional marks starts to take more time. 0 over the next 2 minutes, you gain a further mark, and then over the last 3 minutes, you get one more mark. In 10 minutes, you have scored 8/10, and it is time to move on. You could stay on this question, racking your brain, but it might take another 5 minutes to get up to 9/10, by which time you have lost out on the opportunity of getting the 6 easy marks on the next question. 8/10 on all 10 questions gives 80%. 9/10 on 7 questions and 0 divided by 10 on the remaining 3 gives 63%. You have to be tough with yourself on the timing. When you are out of time for that question, move on. You can always come back to it at the end if you have time. Note that even if you don't know much about the answer to a question, you are better off making a stab at it and getting maybe half marks for that question than spending that time on a question that you know more about and getting perhaps one additional mark. Answer all the questions that you are supposed to answer. After the exam, many students loiter outside the exam hall talking about the questions. This helps some students let off steam, but for others, watching a colleague look through the books and punch the air saying, yes, another one I got right. Every minute or so can be irritating at best and disastrous for self-confidence for the next exam at worst. So you might want to walk away and treat yourself to something nice. At some point on the same day of the exam, find some time to sit down and write some reflections. What went well, what helped, what didn't go so well, and what led up to this. From these reflections, write down a plan for preparing for the next exams and stick to it. It might be something simple like bringing an extra pencil or something as insightful as Louise's example above. You might want to share your ideas with other students in your study group. They might have some additional ideas that would be useful to you, and yours might well be useful to them. The key message here is to learn from experience and to continue to improve. Messages from the other side. We, the authors, as examiners, have 4 key messages to share with you. Believe them or not, they remain true and relevant. They relate to the purpose of the assessment, the motivations of the examiners, having some empathy for the examiners, and the noble art of question spotting. Know why you are being assessed. Assessment has various purposes. These include acting as a hurdle to provide you with feedback, to provide feedback on the course. Students often lose the focus of knowing why they are being assessed. Most institutions' final exams are focused on ensuring that graduates are knowledgeable enough, skilled enough, and safe enough to become first-year junior doctors. Some students think that finals are much more and try and study up to some hyper-advanced level, and as a result might have trouble covering all the bases. More worryingly, some students think that finals are much less, and their focus is just on finding a trick to passing the exam, to performing well on the day, to learning just the topics that they think will come up. These students, usually not ready to be doctors, tend to do badly. We have discussed depth versus breadth in your studying elsewhere in this book. Knowing the purpose of the assessment will guide you in your judgment of how to decide how deep to go in your preparation for an exam. Examiners are out to help. Contrary to popular belief, examiners are really honestly not out to get you. A huge amount of effort is put into trying to make the exam as fair as possible, trying to spot every single way that a student might get the wrong end of the stick and working out ways to prevent this from happening. If a question just asks you to list 4 causes of something, there really will be no marks for a 5th cause, and the examiners really don't want you to list all the treatments too. There really are no hidden messages and things to read between the lines. The examiners truly want you to pass, to do well. They will try hard to get the best out of you in order to help you get the best possible marks. Ironically, this might include asking you difficult, sometimes impossible questions to see how you go about trying to answer them. You might find these challenging questions unfair, but give them your best shot. You might be surprised by the results. Transference. Transference is a term from clinical psychology whereby a patient assumes that their therapist or doctor is feeling the same as them at a given time. You will be aware of this from your own life. Whenever you have been embarrassed, you probably assumed that the rest of the world was embarrassed too. Buying condoms for the first time from a chemist or supermarket is a good example. You are likely to feel that everyone is looking at you, that the person behind the till is thinking something about you, whereas, of course, although this might be the first time you have ever bought condoms, this is the 10,000th time that they have sold them, and they are unlikely to even be consciously aware of the fact. The same happens in exams. Students enter the exam room very anxious and in a hypersensitive state of awareness. For these students, everything is directed at them. An examiner yawns, and this is a personal message aimed at the student. Because of this transference, many students can be thrown in the exam, their anxiety levels spiraling out of control. The key to control is recognition. If you know that the feeling in your gut is just transference, that everyone around you is as anxious as you are, then you can smile and let it pass. If ever you get the chance to be an examiner yourself, even for a mock exam, jump at the chance. Understanding the examiner's perspective is hugely valuable. My medical school put on a mock OSCE where I played the candidate, and in the second half I was an examiner. I didn't expect it, but I learned much more from being an examiner. To a 4th-year medical student, examiners are only human too. Examining is often tediously boring. Marking essay after essay on the same topic, or trying to spot key points in short answer question after short answer question, or listening to 150 students in a day ask a simulated patient how much alcohol he drinks and whether he has ever thought of cutting down just isn't fun. If you know this, if you can put yourself in the examiner's shoes, then you can make their life easier, and in doing so help them to spot the marks that you deserve. Make sure that your answers are easy to follow. If your handwriting is terrible, work on improving it and write key points in capitals so that they stand out. Consider 2 responses to the following short answer question. Q6 describes the initial clinical presentations of myocardial infarction. Classical presentation. Symptoms: chest pain, classically crushing, central, may radiate to left arm or chin. Not relieved by nitrates or rest. Associated symptoms: sweating, nausea, vomiting, collapse, breathlessness. Past history: may have past history of angina or other cardiovascular risk factors signs. May look generally unwell, sweaty, tachycardia, in pain. Blood pressure up or down or normal. May present with cardiac arrest, atypical presentations. Atypical chest pain. Fever plus divided by heart failure about 12 hours post-MI. cardiac arrest, asymptomatic myocardial infarction found at screening at some later date. Myocardial infarction can present with chest pain not relieved by glyceryl trinitrate. Sometimes there might be no pain. Patients might vomit and often look generally unwell. The pain may or may not be present and may be confused with indigestion. It is classically central and radiates to the left arm or chin and may be described as crushing, although sometimes there might be no pain. History gained from the patient or their relatives might be suggestive of an increase in cardiovascular risk factors, and sometimes blood tests would have revealed a raised cholesterol in the past or raised blood pressure or angina. Blood pressure at the time of myocardial infarction might be high or low or normal. Myocardial infarctions that don't present might present late with fever or sometimes heart failure. Imagine that you are marking both these answers and that you have a marking scheme that lists all the key words that would earn the candidate a mark. The candidate on the left, therefore, has made your life easy and it is simple to tick each key point. It is much harder to spot the marks in the script on the right. Question spotting and blueprinting. As a student, one of the authors spent many hours looking through past papers for recurring themes and patterns, making charts and graphs and trying to second guess the examiners. If a topic tended to come up every other year and didn't come up last year, it would surely come up this year. This is a common pastime amongst medical students, with days or weeks wasted trying to predict the future. Some graduate and go on to play the stock market, producing similar graphs of share prices, but most of us learned sooner or later that it was pointless. When setting the content of an exam, examiners go through a process called blueprinting. In this process, they look at the content of the curriculum and ensure that the exam samples a wide range of the curriculum that is expected to have been covered by this stage of your training. The blueprint puts a little more weight on important things. So more questions will fall into this category, but the blueprint ensures that everything that should have been covered could be covered in the exam. This is why it is important for you to think about the purpose of the exam. This will give you a clue as to the likely content. Here is the bad news. In addition to looking to the curriculum to build the blueprint of the exam, they also tend to look to the blueprints of the same exam in previous years. They will know if a certain question tends to come up every other year, and they will know that the students know. To avoid alternate years of students not learning the topic, they might decide to drop it into an unexpected year or leave it out for a couple of years. Really dedicated examiners will even turn to the blueprints of the other exams that you have sat and will be sitting to ensure that there is a really good spread of topics, with important things coming up quite a few times and rarer, less important things covered less often, but still making an outing from time to time. If you wish, therefore, to guess the content of the exam, ensure that you know the purpose of the exam and the level expected. From this, you will be able to list the important and common topics that are likely to come up. You need to know these well. And also the less common topics that might come up. You will need to know enough about these to be good enough at the level of the exam. Making predictions any more specific than this is just a waste of time that you could be spending studying.